Welcome everyone to this evening's virtual open house on the graduate programs in population health management. This evening I will be presenting. This is Kelly Curtis. I'm one of the admissions officers here in the department. I've been working with these programs for over 2 years. I would like to introduce Dr. Mark Bittle, the program director, and I'll turn it over to him to share a little bit more about his background.
Thanks, Kelly. I appreciate it. Welcome, everyone. As you heard, my name is Mark Bittle. I am the program director for the Population Health Management program at the Johns Hopkins Bloomberg School of Public Health. I'm also a professor in health policy and management within the department, within the school. I have been with the program, actually was the sort of the creator, if you will, of the curriculum for this program, and then I worked with a number of our faculty across disciplines to develop the courses that go into it. And prior to joining the faculty at Bloomberg about 3 years ago, I have been in healthcare for 35 years. My primary area of focus has been in the ambulatory and physician practice arena. So I have a lot of experience on the community side, working with physicians in community practices, and I've always had an interest in helping to develop closer relationships between the clinical side of the house as well as then merging in the public health side. So when I joined the faculty several years ago, one of the first projects that I started to work on was develop this program in population health to create a bridge between the public health sector and the healthcare sector. So that's a little bit about me. So what we're going to talk about tonight, you can see on the agenda here, just a brief overview of the industry. I think everyone probably has a good sense of where things are going from a healthcare perspective and why population health is so important. So I'll be brief in those comments, but you're welcome to ask questions later this evening as we wrap up on that. I'll share with you some of the program details, in particular the curriculum, the idea that this is an online program and what we've done to facilitate online learning for our students, introduce you to the faculty, and then I'll turn it back over to Kelly to talk about admissions, financial aid, and then we'll again open it up for questions and answers. On the slide, I share with you just a quote from a program that I put together for the American College of Healthcare Executives. As you saw, I'm a fellow in the American College of Healthcare Executives, and one of the things that I think is so important is the fact that with the transition from volume to value-based reimbursement, there's been a need to develop new competencies as leaders and healthcare administrators. But as we move to what I think is yet another step, and that is from value-based reimbursement models to population-oriented health delivery initiatives, it's going to require new competencies, not only among the healthcare sector, but also new competencies within the public health sectors, so that they're able to come together and work in ways and collaborate across sectors that they haven't had necessarily the opportunity to do in the past. So I think it's a very important concept for us to be thinking about as we're moving from volume to value, but I think there's another step there from value to population health. Next slide. So Josh Sharfstein is the Associate Dean for Public Health Practice and Training at Johns Hopkins School of Public Health. He's also the former Secretary of the Maryland Department of Health and Mental Hygiene. And he provided this quote that population health managers who draw upon public health tools will be the leaders of tomorrow's healthcare system. This is largely, and he was one of the driving forces behind the development of this population health program, because again, he came at it from both the public health perspective, but also being a physician, he sees it from the healthcare perspective and really saw that we really need to take what we know from healthcare and then adopt many of the public health tools so that we can create a population health infrastructure, excuse me. So we've talked about, sort of the background for this. We have a very siloed and fragmented system in our healthcare model in the US. Our idea is to link many of the tools related to public health so that we can begin to think about healthcare in a more broad, out beyond the four walls, as I like to say, of the traditional health system. That is clearly being driven by a shift in how we're being paid. So moving from volume to value has caused us to really think about quality and patient experience, but it's also started to get us to think about how do we focus on those things upstream that are causing poor health. Many of those are what we call the social determinants of health. And so it's important for us to be thinking more broadly about how we deliver care beyond the episodes of care. So this program is really meant to bring not only a healthcare management focus, but also introducing many of the tools and practices of public health into the management and transformation of delivery systems in the US. Next slide. So population health management has been around for probably about 10 years. David Kindig was sort of one of the early adopters of the term population health management. But we see it, and certainly within the School of Public Health, is an important part of what we teach, not only looking at it from the public health perspective, but also looking at it from the healthcare provider perspective. So I think we're pretty uniquely positioned as a School of Public Health, the #1 School of Public Health at that, to be able to start thinking broadly about how we can merge the two sectors together, public health and healthcare, to really truly transform healthcare from a value-based to a population-focused model of care. And it's important to be thinking about this notion of accountable care beyond just what an accountable care organization is, which is really a means to bring together organizations and link payment models to improving the health of that given population, but looking at it much more broadly as we define populations much more broadly. So as I mentioned, one of my initial projects in joining the faculty of the School of Public Health, I had been teaching part-time at Hopkins for about 20 years and had the opportunity to join the faculty full-time and did so. And one of the things I really enjoy about the school is that we have the opportunity to create these interdisciplinary curriculum in many of our programs, and this truly is an interdisciplinary curriculum. There are a number of departments in the school: epidemiology, biostatistics, health policy and management, health behavior and society, international health. Every one of those departments that I've referenced have contributed coursework and course content to this curriculum. So we really do see it as a very well-rounded and interdisciplinary focus on not only the determinants of health, but also then bringing in things like behavior, lifestyle, and a broad range of social, environmental, and economic focus into how we improve medical care and health in our communities. Next slide. In thinking about this program, of course, we were looking to make it as broadly applicable as possible in terms of the audience. One of our targeted audiences, though, and this was an area that was particularly important from my perspective, having come out of the healthcare world and having worked with hospitals and health systems to think about how do we move our services more upstream? How do we think about dealing with some of the social determinants of health and those factors that are influencing patients visiting our emergency department, increasing our readmissions, looking at potentially avoidable utilization. So all of those things were really important to us, and I felt that one of the key areas that we wanted to focus on were clinicians, because they were really at the forefront of having to make some of these changes in healthcare, and also in being able to observe much of what was happening in their communities that were influencing health. So targeting physicians and clinicians of all sort is really important to us, as well as the managers of care, because I think together they're going to be partners in truly transforming healthcare delivery in the U.S. So it's important that we look across many of the areas of public health. But that's just sort of the tip of the iceberg from my perspective in terms of who we're targeting this program towards and the types of careers that we see emerging from population health. I've listed some of the potential job titles there, but they're growing by the day. Vice presidents of population health, directors of healthcare integration, vice presidents of care coordination integration, directors of community health operations or outreach, population health initiatives managers. Just again, to give you some representation that healthcare is truly transforming, and one of the easiest ways, I think, or more readily apparent ways to see how healthcare is transforming is to read the Help Wanted ads to see what organizations are looking for in terms of skills and competencies. And many of today's healthcare job openings are related towards this notion of thinking outside the four walls and helping to create collaborative arrangements with public health as well as other healthcare and community-based organizations. Next slide. So we designed this program to function in two ways. First is for those, first of all, it's a part-time program, so it is really based towards those that are working in the field, both whether you're in a public health field looking to gain a better understanding of how healthcare works, to bring that educational perspective, or from the healthcare side looking to gain more of a public and population health viewpoint. It is truly geared towards the working professional. So it is part-time and it is 100% online. So there are no face-to-face on-site types of activities that you participate in other than graduation. But it's broken down into two pieces. So the first year's curriculum, if you complete those 25 credits, you will earn a certificate in population health management. You can stop there, and that could be what you enroll in to start with, is just to enroll in the certificate program. Again, you'll complete the first term curriculum, 25 credits, 8 courses, and you'll be finished and earn a certificate. Very nice, certainly looks almost like, well, it looks exactly like, in many respects, the diploma for a master's degree. It just simply says certificate in place of the master's. If you decide to enroll, so you have two choices then. You can either enroll to complete the master's, do the second year of the program, or you can enroll right from the beginning to do the master's in applied science. So it's an MAS degree in population health management. There are, as I mentioned, 8 courses in the first year. There are 8 courses in the second year. So by completing all 16 courses, one of which is related to this idea of an integrated activity considered a capstone that you have to do at the end of the program, where you bring in everything that you've learned throughout the 2 years and apply it to this case-based situation. I mentioned 2 years. Again, it's a part-time program, so you have up to 2 years to complete the certificate, up to 4 years to complete the master's degree. We've admitted now, working on admitting our 3rd cohort of students. 30 of our first cohort of students have actually been taking 2 courses per term, which means they're on track to graduate in 2 years, which would be this upcoming June. So again, it is possible to complete the program and get your master's degree in 2 years if you take 2 classes per term. Our terms, by the way, are 8-week in length. So the first 2 terms take you up to Christmas. There's generally, there is a winter break, about a month, and then the last 2 begin about the end of January and run through the beginning of May. And again, those are 8-week terms. It's 100% online, so each of the courses are not your typical, or if you've taken an online class before, they're not just sitting down, listening to a recording, and then sort of taking a test at the end, and then you can move on to the next section. These are actually weekly courses. You'll listen to recorded content online. There will be assignments and things that occur on a week-to-week basis, but it's really measured out so that you're able to work on 1 week's activities in that week. At the end of the week, you then move on to the next week. So it's like being in class, but essentially you have the entire week to complete the first module, then you go to the second week, complete the second module. So you can't sort of speed ahead. It's really metered out so that you get the most out of the learning experience. We have designed this program to be very much focused on group learning and peer assessments, peer learning. So many of the courses have group projects. Our students have been very adept and very positive in their feedback on our ability to create meaningful group assignments that, of course, you work on virtually. And many of the students, it's amazing to see how they've gotten to know each other over the years by virtue of working on these group projects. So very positive feedback on those. As I mentioned earlier, it's a Master of Applied Science. The key word there, in addition to being a Master of Science degree, is that it's an applied science degree, which means all of the courses have been developed with this idea that you're a full-time practicing professional, and we want to give you the tools and skills and competencies to enhance your ability to do your roles from a population health perspective. And so it's important for us that everything that you work on is applied in nature. It's very skills oriented. So the projects, the cases, the discussions that occur online are all predicated, even the articles and readings are all predicated on being very applied, very practical, so that it's much like a very hands-on learning experience. I liken it to when I did my master's degree, although back then they didn't have online masters, but I did it part-time at night, and so I was able to take much of what I learned every evening back to work with me and actually apply it and start using it the next day. This course, this program is built very much on that foundation. So the goal is really on understanding and focusing on what population health management is, and then also, thank you, and then also how to apply that within and across populations, within and across sectors. So a lot of focus on cross-sector collaborations. Next slide. So this is the year one curriculum. There's a prerequisite that every online student has to take, Introduction to Learning. There are no credits associated with that. You have to complete that before you're able to start your classes in term one. So it's important to understand that has to be done before you can start taking classes. As you can see in term one, we talk about the essentials of population health. That class is taught by a physician, Ashwini Davison, who's a practicing physician who's teaching as part of our adjunct faculty. She and I worked on that course to really provide essentially an overview of the program. So she really hits on a lot of the major topics that will be talked about in much more greater detail through the various courses that you'll engage in. So that's really, again, to me, sort of an essentials course to give you a broad overview of population health management, all the various components, the importance of data analytics, the importance of understanding populations, the ability to stratify those populations, building care management programs to address the various needs of those populations. Everything that's covered in the program, we sort of condensed down into this course to give everyone a good basis of understanding to start from. Another course that's available in the first term, the other first term course, is Principles and Applications of Advanced Payment Modules in Population Health Management. I teach that course, and again, it's meant to provide people with an understanding of, we presume some level of understanding of payment methodologies, but we do sort of take a step back and talk about the evolution of health insurance and commercial Medicare, Medicaid. That's like, we do that in one module. The other 7 modules, though, we really start to think about some of the advanced payment models, models that are coming out, in, for example, the impact of MACRA and MIPS, which we will explain in the course, but many of the CMS demonstration projects around payment reform. We look at accountable care organizations, and essentially, help people to understand the importance of aligning payment models to healthcare transformation, in particular population health and population health management strategies. Term 2, we have a course on collective impact, which I also teach. So we really focus on how to develop and lead community partnerships effectively around population health. We have an accountable care course that talks about assessing quality and effectiveness in population health initiatives. Many of our students are working in health systems. They're physicians. They're folks that are involved with improving quality and performance. But this class really takes it to the next level to say, how do we evaluate quality and effectiveness in a population health setting as opposed to what we're used to in our acute care settings? Term 3, we look at population and consumer health informatics. So it's an IT course, but it's really focused on how do we use technology to allow us to engage our populations and stratify our populations. There's an epidemiology course, which I think is really fundamental from a public health perspective to understanding disease burden and burden of illness in our communities. Fourth term is we have a biostats course, so statistical concepts in public health, and then finally managing health across the continuum. Again, Ashwini Davison, whom I mentioned in the first term, and another of our adjunct faculty co-teach this class on contemporary models in disease prevention and care management. So again, we may be very familiar with care management principles from a hospital perspective and how that's evolved and changed as care moved from the hospital to the ambulatory to the physician practices. But now we really have to think differently about how we manage care across a continuum, when that continuum includes communities, homes, other sources of care, and also disease prevention. Next slide. So year 2 is shown there at the bottom of the slide. It continues on. So if you complete year 1 you enrolled in the certificate program, you're done. You get your certificate, you've completed. If you want to go on to the second year, you would have to reapply to the program for the master's degree. If you enrolled in the master's degree from the beginning, once you complete the year 1 curriculum, and you have up to 2 years to do that, you will automatically get the certificate, and then you will move on into the second year of the program. The second year of the program, I'm not going to go through each course there in detail, but you can see much of it is now higher level courses looking at how to create high reliability healthcare, concepts and leadership strategies. There's a health behavior course that, again, through our Department of Health, Behavior and Society, where we talk about improving health through health education and promotion, because a lot of prevention and a lot of lifestyle changes are going to occur through your abilities and organizational abilities to influence behaviors. So consequently, we've included that course. We teach a systems course to give you an idea of the importance of systems thinking as we think broadly about how to organize for public health. And that's not public health as in the School of Public Health, but a public's health. So again, it gives you a very systems-oriented approach to thinking broadly about change in these complex social situations. We teach a behavioral economics and risk course, so we think about some of the incentives that value-based payment models bring not only to patients, but providers and other folks that are a part of these global payment models that may well be the basis for population health in the future. So there's an economics component to this. We have a course on the built environment. So we also, again, are looking outside of the traditional sort of realm of healthcare, but thinking about the importance of those other social determinants, not the least of which is our physical environment, housing, et cetera, and the influence that that has on health and improving health in our communities. Value-based concepts of socially responsible leadership is a course that I have developed and I teach. I'm actually teaching it this term right now. And it talks about, again, this notion of leadership, these new competencies, this new mindset that we have to have as we enter into these population health arrangements, and in particular, as we think about cross-sector collaborations. And the final thing in the fourth term of the second year is a course on social and cultural basis for community and primary health programs. So again, we're looking at how do we create socially and culturally competent primary care and community-based health programs to help improve the population's health. And then finally is the integrative activity, which is essentially a capstone, which all master's degree programs require in the last term. And in our case, the capstone is based on a case. There are 3 components to the case, and so students are asked to develop a 20 to 25 page paper in response to the case that we provide them. Next slide. I think this is my where I'll turn it over to Kelly in just a second, but to say that, you know, our school has been providing online learning for quite a while. Our master's in public health has been online completely for some time, so there's an in-person as well as an online version of that, and we continue to develop our online capabilities and capacities. This foray into the MAS program in population health, as I say, is now going into its 3rd year, and we're getting ready to graduate our first cohort of students, some of whom have already gotten their certificates, but this will be our first cohort of master's students. We have put a lot of thought into the courses because they are 100% online. We relish the feedback that we get from our students about what they like and what they don't like, and we use that every day to try and improve what we do to make our online courses not just sitting there listening to recorded videos or lectures, but to make them very interactive, to make them very engaging for the students. One thing that I will mention is virtually every course has at least 2 live talks along with them. This is where the faculty get online with the students, much like we are this evening. And we, you know, are either having, I use it for my courses in particular to invite guest speakers to participate. Others use it for a variety of, particularly like in biostats, to work through, you know, problem sets or what have you. But I want you to know that the faculty are very engaged. Every one of the faculty in the program, and there's a list of them on the next page, next slide, they treat this like any other in-person course. So they are very vested in this. They're very engaged in it every term, and just because it's online, they don't treat it any less. And I think that's a marvelous testament to their commitment to education. Again, because, you know, the lectures are recorded, you do have the ability to not only listen to them at your leisure through the course of that week, but you can listen to them multiple times. You can download the slides as a voice module. You can download the transcripts, so everything that I'm saying in my lecture is recorded, but it's also there in writing. So if you wish to print the transcript of the lecture and that makes it easier for you to study, you can do that. All the readings are available online through our library. So again, it's very efficient to just click the link and get the list of readings by week. Everything you have to do is right there at your fingertips in our learning management system. Next slide. So I'm just going to end my piece here by talking about our faculty, who I constantly brag about. You can see their names listed there. I would say, in quickly looking down that list, virtually 60% of those are full-time in the field of healthcare. So David Baker, as an example, is the director of ambulatory quality and population health for a large health system. He also worked for CMS at one point in his career. So many of the faculty that we have are actually practitioners, as opposed to being solely full-time faculty researchers. I mentioned myself, of course, I came out of healthcare after 35 years, so I consider myself very much a practitioner as opposed to a researcher. But we do have a good combination. Andrea Galen is very well known in health behavior. And so there's a combination of not only the research and the academic and the theory, but a very heavy emphasis on the application and the practice. And we hope that makes this, again, a very applied, very real, very hands-on, very roll up your sleeve, and take this stuff and use it the next day at work. That's our goal. Next slide.
Mark, thank you for providing such great information about the program. If anyone has questions so far in the presentation, go ahead and type those into the chat box, and we will address those at the end. So I'll cover a little bit more about the application or admissions requirements. We use a centralized application portal called SOPHIS for the master's programs and SOPHIS Express for the certificates. Some of the requirements include a bachelor's degree from an accredited college or university, a minimum of 3 years of health-related work experience, a current resume or CV that demonstrates your healthcare accomplishments. For the certificate, it requires 1 letter of recommendation. For the master's, it's 3 recommendation letters. The statement of purpose is an important part of your file. You need to show how your educational and career goals do align with the educational objectives of the program. And for any of our international students, we do require a course-by-course evaluation. We do recommend using WES or World Education Service. And if English is not your first language, you may need to take a proficiency exam such as the TOEFL. Completed files are reviewed monthly. We do encourage you to apply early. The deadline, the last deadline to submit your file is July 1st for our One Start a Year, and this year it does start on Tuesday, September 3rd. We do already have students accepted into the program, so we do again encourage you to apply early. So I'll cover a little bit more on the tuition and financial aid. The current tuition is $1,128 per credit hour. We do have a partial scholarship. It's the OPAL scholarship. It's $433 per credit hour. So the cost to the student is $695 per credit hour. This OPAL scholarship is awarded to all students who do get accepted into the program, so there's no additional application steps or forms required. Tuition and scholarship is reassessed each spring for the fall term. So any changes will be updated on the website in the next few months. So keep a lookout for that. Beyond the OPAL scholarship, the Financial Aid Office does provide both federal and private loans. So we do get you in touch with the Financial Aid Office to work out those details. And if you are interested, our school code for FAFSA is E as in excellent 00234. That's E 00234. So now I'll turn it over to questions. So it looks like the first question is asking about the time commitment that students should expect each week. Mark, did you want to cover that?
Yes, it's a great question too. So you may have noticed on the curriculum, most of the courses being offered are 3 credits. So the typical rule of thumb for a 3-credit course is that you're going to have about 9 hours of week of work to do. I would say that most lectures are probably not more than an hour in length. So much of the rest of that time is really in readings and working potentially on group projects or assignments for the courses. When I say the lectures are an hour, I would clarify that by saying that they're typically an hour if you add the pieces all together. But we work very hard with our instructional designers to break the lectures down into sort of meaningful chunks. So you may be listening to a 6-minute lecture, and then it may be another 12-minute lecture, and then there may be another 15-minute lecture. So you may have 3, 4, or 5 mini lectures in the course of the for that module of recordings, but it's broken down again so that you can listen to them in pieces. You're not having to sit there and listen to it all at one time over the course of that total length. As I mentioned earlier, you have the ability to download it as a WAV file, so you can listen to it in other media. But you have essentially what happens is on Sunday, the module or that week's work becomes available to you in the learning management system, and you have until the following Sunday. You have until the following Sunday at 11:59 p.m. To complete everything for that week's module. So that would include listening to the lectures, doing any assigned readings, and if there were any activities or assignments that were due for that week's module. So I would say it would be a safe bet. And I'm sorry to belabor it, but I think it's a great question. A safe bet per course, you could probably spend anywhere from 6 to 9 hours per week per course.
So we have a question as far as what you're looking for in a candidate's background. There's two questions that kind of relate to this. One is healthcare experience, what that looks like. And then we have another question that saw that there is, a statistics class in the program. Is an undergraduate statistics course required? What are you looking for that?
Yeah, both great questions. So the healthcare experience, we do require some healthcare experience. We are pretty broad in our application of relevant healthcare experience. We want to see, I think, more so than the experience. So, we have students that work for insurance companies. And we have students who work for pharmaceutical companies. We have folks that, of course, work for acute care or ambulatory care or physician practices. Probably in our total population, maybe 20 or 25 of our total number of students actively enrolled are physicians. We have some nurses. So, the healthcare experience we're looking for is just because we want to be sure that that you have some basic understanding of healthcare in the U.S. Now, I will again sort of make a caveat there. We have 4 students from Canada. We have 1 from Mexico. We have 1 from the UK. So international students are also in our program because, interestingly enough, and I had the good fortune to go to Saudi Arabia in June and to Beijing, China in August of 2018. And both countries are very much interested in understanding all that they can about population health because they're very focused on sort of transforming their delivery systems and sort of leapfrogging over all the things that we've already sort of experienced and going right towards this notion of population health and population health management. So the reason for the several years of healthcare experience, which we interpret very broadly, is really so that you have some inkling of how our system works today. The other piece, though, is, and I think it's more important, is from the statement of purpose that you provide us. Why is this important to you? What are you going to do with it? Because it's an applied program, we're really looking for students that are going to be in a position to take this and do something with it. We hope in every case that you're able to advance your careers by having a master's degree for sure. But also we're hopeful that you're going to be in a position, or this is going to allow you to move into a position where you can actually influence transformation. So it's important for us that you have some experience, but it's, I think, more important for us as we evaluate applications to get a sense for what you're going to do with this. Because again, we're hoping to be training people to actually go out and make things better for our populations. The other part was the biostats, correct?
Yes, that's
That was
correct.
the other question. Yeah, so biostatistics. We're in a school of public health, so it's sort of incumbent upon all graduate programs in the School of Public Health to have a biostat and epi course. I would not argue against having the EPI course by any stretch of the imagination. I think it's an important public health tool that is very important in a population health strategy and management plan. The biostats, I think, are also important for our students. Because we don't require the GRE, we do look very closely at how students perform as an undergrad or whatever their most recent education, because we have students, again, who are physicians who have master's degrees already. But we do look at what they've done from a math and statistics perspective. And if the student is otherwise, a wonderful candidate for the program, but has not really, maybe has a master's degree in history, and I'm sort of making it up to be egregious here, but then we would reach out to that student and say, look, you're definitely admitted, but there's clearly going to be a biostats class, and for you to be successful, these are some online courses. Most of them are free, but our statistics faculty have pointed them out to us as resources for our incoming students to say, look, maybe you had biostats a long time ago, maybe you've never had biostats, but here are some resources that are available online, no charge. You can go in and at least refresh yourself or get a basic understanding of biostats before you go into it from the course perspective. Having my doctorate in public health from the School of Public Health, I had to take 4 terms of biostats. I am not a biostatistician by any stretch of the imagination, but I can attest to the fact that the faculty and the TAs in that course that we provide in our program are very attuned to helping students be successful. So there are many opportunities. The faculty that teach that are wonderful. So again, I think we've worked hard to just look at people's applications to make sure that we can predetermine if any folks may, feel that they're going to have a challenge, and then we reach out and provide options to them to help bolster it before they get in to the course itself.
Thank you, Mark. We have a student that wants to know that if they happen to be in the Baltimore area, visiting, or perhaps they live there, if they can set up time to meet with faculty.
Absolutely, and I was going to close by offering that as well. So I make this offer to our current students if they're ever in the Baltimore area, conference, passing through. A few folks have stopped by because they have family over Thanksgiving. I am always available. Other faculty have always made themselves available to give you, a tour of the School of Public Health, to just meet and talk with you about the program. So yes, absolutely. Matter of fact, I'm doing a board retreat in Salem, Oregon in the beginning of March, and they're wanting to understand more about population health. They're doing a lot of really nice things in the state of Oregon. But one of our students is in Oregon, and I send her an email. I said, hey, I'm going to be in Salem on this date, and she's, oh my gosh, that's only like 20 minutes. Let's meet for coffee. So I've met a number of our students that way as I travel around or they travel around. So we would love to have students or potential applicants come and visit the faculty in school. So I think pretty certain my contact information is either available here or can be retrieved through Kelly without a problem. So happy to do it.
We have a similar question. Are students able to engage with faculty directly and support research projects or opportunities?
That's really up to the, so yes, absolutely, all of our faculty. Again, this is not as an online program, and these are just not recorded lectures that you listen to, take a test, and move on, and never really have any interaction with faculty or teaching assistants. This is just like an in-person course, except you're doing it like we are tonight, virtually. So yes, there are many opportunities. All the faculty are happy to talk to students, engage with students. I should mention. Well, let me finish answering the question. Relative to research opportunities, that's really, I really have not met any faculty, particularly some of the full-time faculty, who would not want to engage with students who have similar interests and in helping to either further or promote or get engaged in research. It's certainly not required for the program, so it's sort of extracurricular and up to the student and faculty to work out. But we have a very amenable faculty in that regard. I did want to mention, just it made me think about that. Made me think about this with the question. All of our students, as an online student, you are assigned a faculty advisor. And so you will have someone that you can reach out to, in addition to the registrar's office and those that would help you from a broader program perspective. But in terms of thinking about career advice, thinking about how's this program going to help me. One of my closer students, he's a physician in Georgia, rural Georgia at that. But when his health system found out he was in this program, they're now starting to tap him to sit on committees where they're starting to talk about what role should we play in population health. What is population health, by the way? So he and I have gotten to know each other pretty well, because he'll call me on a Saturday or a Sunday and just talk for an hour about what they're doing, what they're thinking about, how should he think about something. I know I do this with the students in the program, not just those in my course, but I send articles out all the time, just FYI stuff that I come across. Students in the program send out articles to each other and things that they come across. So it really is a very, has become a very vibrant community, even though it's an online program. But it's important to know you will have a faculty advisor in the program.
I get this question often in speaking with students, but I'll let you answer this, Mark. What are the maximum and minimum number of students accepted into the program?
We don't have a minimum that I'm aware of. I think as a maximum goes, we're happy if we and we've exceeded this, but in the years past. But I think for a good class size, and I'm speaking strictly for myself as a faculty member, a good class size online is about 60 students. But of course, not all students are taking 2 courses per term. So some students may be in my class, or they may be in the other second term class. But most of the class sizes have been averaging around 60 students. That makes for a fair bit of work, but with some teaching assistant support, it really is a decent online class. Program-wise, we have well above 120 students in this particular program now at some point in the process. So we don't really have, it's a great question, but we don't have any upper or lower limits to the program.
I have a physician who is finishing up their MBA and would like for you to provide some feedback whether the certificate would be sufficient enough for opportunities in population health.
So a physician is finishing up her MBA, or is that correct?
That's correct.
Is it a straight MBA or MBA with like a healthcare concentration?
It is with a concentration in healthcare.
Okay, so I would say yes and no. I would say yes more so than no. I'm sorry to hedge my bet there a little bit, but I do think having an MBA with healthcare concentration is much like getting an MHA, a Master's in Health Administration. And then I think the certificate would certainly give you, because in that, of course, as a physician, you'll have the epi and the biostats in your background anyway, and that's part of our first year curriculum. But the other courses, I do think, give you a really good understanding, a more broad understanding than what you would get in an MBA. Of course, I don't know the program that you're in, so most of the MBA programs with healthcare concentrations that I'm aware of or familiar with this will give you certainly good exposure to what population health and population health management is. So to the extent you've not had that in your curriculum, I would say the certificate would be very useful. I'm not sure that I would, unless you are so inclined, to have 2 master's degrees, but I would definitely say that the certificate would be a worthy investment, and I think very complementary to your MBA with a healthcare concentration.
Okay, I have a question. If you work in the healthcare insurance or in data analysis in healthcare, how would this program be a good fit?
So if you work for a health insurance, so a number of our students are in health, on the health plan side of things, and I think many. I was actually surprised to learn how many pharmaceutical companies are now developing population health departments or divisions within their pharmaceutical companies. So population health has really taken off in the pharmaceutical sector. It's also, and it has been, developing for a longer period of time in the health plan sector. More so, I think, than even it has in the hospital sector. So I think having this degree, particularly if you're involved in any of the data analytics elements of being in the health plan, is very useful, because you need to understand why you're collecting this data, and what you're doing with the data, and how that data are going to be used to improve health, to stratify populations, to target interventions, to think about, how do we engage these our beneficiaries with health promotion or wellness programs in their communities, how we link them up through various resources that are available through community-based organizations or other faith-based schools, etc. So I think it's a very useful way to understand the business, because I think part of what I mentioned earlier, part of the goal of this program was really to begin to build a bridge between public health and healthcare. I would also argue that what we've seen over time with these value-based payment models, and now the transition to population health, is that the bridge between healthcare and health plans, the insurance side, is starting to come closer together, because both sides realize, much like public health and healthcare, that we're not going to be able to improve health of a population in our own respective silos. We just don't have the bandwidth, we don't have the competencies, we don't have the ability to create the leverage independently, as opposed to what we can do collectively. So I think the more healthcare knows about health insurance, the more health insurance knows about pharmaceuticals, the more pharmaceutical knows about the community, the better off we're going to be from a population health perspective. So I hope I answered the question.
Thank you. I think you did. There's a question that I can actually answer. Somebody wants to know if the GRE is required. We do not require the GRE. The admissions committee does review all the documents in your file for an acceptance decision. And it looks like that's all the time that we have for this evening. Thank you so much, Mark, for being so thorough and providing such great insight into the master's and the certificate in population health. We appreciate everyone joining the virtual open house. A recording will be on our website as soon as it is available, or you can reach out to me and I'll provide that link directly. If you have any additional questions on the program, or if we did not get to your question, we are happy to answer your questions. And if you are ready to move forward with the application, we're here to assist with those steps and questions about the application process. We do have a dedicated admissions team here that is looking forward to working with you. Everyone have a great rest of your evening, and we do look forward to hearing from you.
Thanks, everyone. Kelly, thank you for your help. And again, if there are any questions that I can answer, please don't hesitate to reach out to me.
Thanks again, Mark.